Okay,
Hi.
finally.
Hello,
Hi,
my friend.
good
Oh,
evening.
finally.
But we did it.
Yeah. No, finally. Because we have a huge ocean between
I,
us, the
I
Atlantic
know.
Ocean. So,
I
yeah,
know.
the internet takes some minutes to cross it.
Yes, indeed, indeed, indeed. But we did it, and I'm very, very happy. And I feel very honored having this opportunity to speak with you because you have a huge reputation.
Oh,
You have a lot of experience, and I'm very exciting to exchange with you live my experience, and also we're very open to respond to the questions of our
oh,
audience.
very good. The honor is mine. When I was trying to begin, I was talking about you to, well, the audience. I told you about where and how I met you in Dubai. How interesting was to see your skills, the way you analyze cases, the way you touch patients, and yes, it was a very interesting experience for me to receive you in our courses in Dubai. You are a very skilled doctor, and I'm so proud of having you here.
Thank you
Well,
very, very much. I'm
yeah.
getting red.
Oh, come on. Don't be red. Be
Thank you,
natural.
thank you, thank you.
Yes, I'm so excited to stay with you. We suppose we were talking about those Dr. Felipe Tozaki from Brazil here. Nice to have you here. Souza Fran, many people coming in. And we discussed in Dubai about some procedures. I was talking to people about what did we do in Dubai. I think it was in June or July. It was in June.
In June,
June,
yes,
yes, yes.
yes, yes,
So we were using the static evaluation for faces, and then fat transfer and static gynecology, isn't it?
yes, indeed,
And
yes,
how those procedures are blooming in the whole world. Even in cultures in the past, it was supposed to be not very important, let's say, aesthetics. And today, everything is changing.
yes,
And here in Brazil, there in Dubai, there in Switzerland, Japan, Australia, things are getting almost the same as a value. Not the most important thing. I'm talking about statics,
yes, of
but
course.
it's not the most important thing in the world. But why not to do? Let's be happy with ourselves. So this is one of the points.
Yes, I totally agree with you, and I'm also very happy and excited because there is too much evolution in the field of aesthetics, and the most important thing is to be informed so that we choose the right technique for the right patient, because it's not all about fillers or botulinum toxin. There are a lot of treatments. That's why it's very important to be informed, and if we apply the right treatment to the right patients, we're going to have the excellent results.
And then I will take this opportunity here to begin. You said the magic word filler.
Yes.
Today, almost everybody knows about hyaluronic acid. This is
Yes.
the king of the fillers in the world. We can use it for face definition, lip augmentation, chin definition, hands, whatever. And tell me about your experience in Switzerland in relation to different concepts we have today, fillers and biostimulants. Because
Yes.
fillers, for those that they don't know, fillers are gels made generally by hyaluronic acid, and we use it to augment or to define a place, a region on our face, for example. And another way, we have biostimulants, such as Elance, calcium hydroxyapatite. This is for stimulation of collagen formation.
Yes. Yes.
What to use? What are your thoughts about when to use one and when to use the other one? In
Okay.
Switzerland, of course.
Yes, of course. Yes, I'm going to share with you my approach and my ideas based to my clinical experience. In Switzerland, the fillers used to be not very populated, like example even in Brazil. That's why the patients and now who come to me, they ask me to correct the loss of volume or to correct small wrinkles. And the first thing that I do, I inform my patient about all the opportunities that we have to treat these small problems. And the first time I start and I work mostly with hyaluronic acid fillers, because as you know, hyaluronic acid is something that it's reversible. So if somebody says it's too much for me, so it is almost never the case, but I can dissolve it. And in Switzerland, it's very important for my patients to have natural results. That's why mostly I work with the fillers, with the hyaluronic acid fillers from the mark Teoxane. You know, we are very proud of it. It's a Swiss brand, and these fillers, these hyaluronic acid fillers, have the RHA technology, and it gives us the opportunity to achieve natural results. So natural results means if we smile and it is not noticed, because there are also other fillers that are very heavy. That's why I prefer to work with these fillers.
Very nice. Let me break you because I want to take your phrase, naturality.
Yes.
When we were in Dubai, yes, in Dubai, there's another culture. Girls over there, they love big lips. They love that way. There's Angelina Jolie and Kardashians. And now we have let's say, technique called Russian lips. This is absolutely huge. What do you think about that? What do you see in Switzerland, those Russian lips? Because Russia is very close to you, not too much, but better than Brazil. Are Swiss girls, let's say, contaminated with the desire of Russian lips?
No, fortunately, no. It used to be in the past, but now the patients and the women in Switzerland, they don't like the Russian lips, because it is something that it can be noticed for everyone. And honestly, if somebody wants these lips, I don't perform it because I don't like it, because my approach is very natural results. So I don't offer. I have my own technique. It is called the Swiss lips. And yes, it
Tell
is.
me about the Swiss lips.
Yes, the Swiss lips is very very known among my patients and among the women and men also in Switzerland.
Great.
And it gives you a natural result, a plump lips natural result, without being noticed for other people. That's why I prefer and I work only with this technique. And of course, there are also cases who want more volume, and in this case I split the treatment in two times. So I perform the first treatment. I use only 1 milliliter per treatment, not more, and I give time. And I see my patients after 3 months, and if they need more volume, I perform one more syringe, but no more than one syringe in the same treatment, and it gives really amazing results.
Very nice. And you told us about to dissolve. Explain people about how can we reach it? How can we do the dissolution of the hyaluronic acid? What do you use?
Yes, in order to dissolve the hyaluronic acid, and we dissolve the hyaluronic acid, and not only if we have vascular complication during the treatment, but if
Hmm.
a migration of the product, if we have something like infection of granuloma formation, and in order
Yeah.
to achieve in order to dissolve the hyaluronic acid, we use the enzyme. It is called hyaluronidase, and we dissolve this. I don't know, in Brazil, here in Switzerland, it is in pulver, and we dissolve it with
Yeah.
clean water, and it depends on the amount of hyaluronic acid that I want to dissolve. I use after the amount of hyaluronidase. And of
And
course,
that's why hyaluronic acid is so safe, let's say,
yes, yes,
because as you say, if you have a problem, for example, migration or granuloma, or even if the patient says it's too much, we have this weapon to dissolve this enzyme, isn't it?
yes, yes, yes.
This is very good.
Yes, and it gives a big safety to the patients, because if I told to them, okay, if you don't like, because the people are very afraid the first time, and
Yeah.
if I tell to them, okay, don't worry, if you don't like it, we can dissolve it, and after they relax and they, okay, it is very good. That's why I almost work first with hyaluronic acid, and after I know my patients, I go to treatments with biostimulators.
Very nice. What kind of biostimulator you prefer, my friend?
Mostly, I use Elance. Elance, it is a gel with a polycaprolactone gel, and I dissolve it. So I don't use it without dissolving. I dissolve it for a natural result, and also for safety reason, to be honest.
What do
And
you use for dissolving?
um,
Saline?
saline water, yes,
Okay.
yes, yes,
Okay.
yes, yes. And
And
it is,
you inject all around the face, let's
yes,
say.
yes. I avoid the periocular area, and
Hmm.
also upper face. So I don't use the product in the upper face. I use the product middle and lower face. And I must say, if it is the right indication, the results are really amazing.
Hmm. And what you say, in your opinion, the right indication for Elance, for example?
The right indication for me is if I have a patient between 35 and 50, and it is not a lot of skin sagging, but
Hmm.
deep it's deep wrinkles. So in this case, I use Elance.
Very nice.
If I have skin sagging and a loss of volume, I prefer to work with Sculptra.
Sculptra
Yes.
is the polylactic acid.
Yes, yes, yes.
So
I
you work with two options because
Yes,
I love both Elance and Sculptra. This is, as you said, polycaprolactone and polylactic acid. And
yes.
why do you choose? What is the indication for Sculptra and Elance in your opinion, Dr. Ingold?
Um, so first of all, I would like to point out that I don't combine both treatments to the same patient, and I prefer to work with Sculptra if I have a lot of skin sagging and a lot of volume loss. In this case,
Mhm.
I prefer to work with Sculptra, and I make a dilution with 1 from Sculptra with 10 ml from saline, and I inject also in this with Sculptra in the middle and lower face. Never, I don't use permanent fillers in the upper face, periocular area, temples, or forehead. I don't make.
You said very nice. Well, this is almost the same thing we do here in Brazil. Hyaluronic acid for natural result. Of course, some people they want a